That's an interesting question. It was absolutely, you drive down the street, on the TV, the radio, you'll hear all these pop-up low-T clinics. I think that, I'm a urologist and I'm just fellowship trained in men's sexual medicine. So I would, we look at the whole gambit of testosterone, erections, penile curvature, the whole picture. So I'm of the opinion that, you want someone who's specifically trained in these matters. So whether it's a urologist or an endocrinologist, so these are physicians who are trained in essentially the hormones or the endocrine system of the body. That's what I would go with, but I guess to each their own.
Yeah, man, and that kind of, boy, you talk about they put pellets in you. That seemed like that would be a radical way to go to do this thing.
Yeah, I mean, actually, believe it or not, pellets have been around for a long time, and they do work well. There are some downsides, but some men love it because as opposed to, like, let's say a pill that you're taking twice a day or a topical solution you put on once a day, you can implant these pellets every 3 to 4 months, and it's a quick 10-minute procedure. So I wouldn't say the majority. I'd say there's definitely the minority of patients who we have on that therapy, but for some guys that's a great option. So it's something that you would want to come and discuss with your urologist or endocrinologist. And really what I'd say is you want to go to someone who offers all the options, not just one, because then we'll go through each one and decide what's right for you.
Now tell me this, does your insurance cover it?
Yeah, so it depends, essentially. Some insurance have better coverage than others, but this is kind of under the purview of sexual medicine a little bit. So just like any erectile dysfunction medications like Viagra and Cialis, and there's many times where testosterone may not be fully covered, but I think generally we can make it so we can find an affordable solution in most patients.
And so what are the symptoms again? In case some guys out there may be suffering from some of these symptoms and they don't know they've got low T. And what you said, what's the range between 300 and what now?
So anything below 300 on a total testosterone in an early morning would be what we would constitute that. And we also check other levels like a free testosterone and an SHBG. So it gets a little complex, but generally below 300 in my eyes is low. But then the symptoms, just to go over again, it's like low libido or low sex drive, erectile dysfunction, weight gain, loss of muscle mass, concentration deficits, fatigue, and in the afternoon just feeling really worn down. So it's essentially, it can affect the whole milieu of a man and how he feels. So, essentially, if you're having these symptoms, it's important to at least get screened. Now, sometimes it may be your thyroid, or it could be, mental health issues like depression. But, I think that checking a testosterone level is warranted in men who experience such symptoms.
Now, what about these advertisements you see on TV, supplement, they'll increase your testosterone if you take these pills and ginseng and all this stuff. Does that help?
Yeah, so this study from the Cleveland Clinic, they kind of caution about these things. They say that a lot of those supplements, these are not cleared by the FDA, so they have not gone through the rigorous study of what these things actually contain. So you don't know what you're getting many times in these over-the-counter supplements, and so you want to be a little careful with that. And also, the other thing I would caution our listeners is that this doesn't mean that everyone should be on testosterone. Like this study, they made a point to talk about that this is not to justify that, bodybuilders, bulk up and juice on extra testosterone. No, this, if you do too much of a good thing, it can become a bad thing. Because in this study, they very tightly monitored the testosterone levels and made sure they were in a good range. You don't want to overshoot, which a lot of times we see in these low T clinics. So there is some gestalt and art to doing this as well.
All right, Dr. Babbar, always great talking to you from the urology group. Is this the group right here in Cincinnati, urology group?
Absolutely, okay. Yeah. We have about 35 urologists servicing the whole tri-state area, so yeah.
All right, thanks for talking with us this afternoon. We appreciate it. Some great information.
Awesome. Thank you, Lincoln. Have a good day.
All right, that's Dr. Babbar.